When Rajesh's dopamine was half of what it should be, his neurologist said it's just multiple sclerosis. We said it was mitochondria, and we were right. Rajesh was 42 years old, diagnosed with multiple sclerosis in 2016. By the time he found us, he couldn't even hold a slipper with his foot. His legs were giving out beneath him, his muscles were disappearing, his body was sending him desperate, persistent signal, and for years nobody was listening. Every doctor he saw said the same thing. This is multiple sclerosis, it's progressive, it's incurable, and here are your medications for life. And Rajesh, like so many of you watching this, went home and tried to accept that fate. Today, Shreya and I are going to break this case open. The labs, the logic, the intervention, not because it's a feel-good story, but because what happened to Rajesh is a masterclass in what becomes possible when you stop treating the diagnosis and start listening to the body. Shreya, when Rajesh's full panel came in first, what did you feel?
Honestly, I felt two things. First, I was completely in shock because so many things were wrong. And second was a sorrow because there were so many things that was missed out. When we talk about Rajesh, backdated history, he was going through a lot of stuff. Emotional trauma was there, there was geographical dislocation, he was going through a lot of stuff, alcohol consumption was there. And during this constant threat, even your immune system starts attacking its own healthy cells. And same thing happens in his body as well. His nervous system was in continuous attack. When his diagnosis was done for MS, it was done based on the MRI. So the lesions was clearly seen in the MRI and the doctor clearly told him it's a MS condition. They just wrote the prescription and that's end. They didn't even took a courtesy to ask what is the reason behind this.
Or the why.
Yeah, even the why. Why his immune system is under a lot of stress. What is the reason behind this? Why this condition? Why these symptoms are occurring again and again?
Because the body doesn't attack itself randomly, right? It doesn't make mistakes. It responds. And when we don't understand the signal, we end up making a pathology out of it. So walk us through his blood work. Like, what were you seeing when you looked at his blood tests?
Immediate red flags.
Wow.
So when we look at his CBC profile, his hemoglobin was quite elevated, which is basically happening because of the dehydration, poor oxygenation. His MCV, which basically tells us about the size of RBCs, that was also quite elevated. So his RBCs were larger than normal. So that is again happening because of multiple nutritional deficiencies. His MCH concentration on another hand was on low, which basically tells us how much amount of hemoglobin is there inside the RBCs. So even though RBC size was larger, the concentration was not quite adequate enough that the body wants. Another thing in his case was his WBC count. They were double in the number.
Wow.
Optimal range. So it was clear-cut telling us there was some hidden infection that is there in the body. And these reports were basically not of the person who is managing MS. This is of someone who is undergoing a lot of chronic inflammation. There's a lot of infection that is there. Right. And another shocking thing in his case was the iron saturation. It was high. So there was no issue as such dietary issues in his case, but there was a lot of liver dysfunction, chronic inflammation, infection. These things were coming up again and again and again in his case.
And then at this point, your instinct was to kind of think that this isn't just MS, right? Like that's how I would have looked at this.
Exactly.
Something far upstream is happening, which is causing MS as a problem.
Definitely. MS does not always come in isolation.
Correct.
Your body tries its best to communicate, and same thing is happening in his case as well. His body is basically making the loudest attempt to communicate. And this is where we actually start going more deeper. And this is where the GI map actually comes in place.
And what did you see in the GI map?
So the GI map was actually catastrophic.
Wow.
So it's not just alarming, but there were a lot of things that were giving us the explanation of the symptoms, why they're showing up. So it's H. pylori, which is one of the notorious bacteria. It was not just detected, but it was significantly high. And this H. pylori actually messes up with the stomach acid production.
Right.
And your body needs stomach acid to digest the protein effectively. So no stomach acid means no protein digestion, right. And the amino acid absorption is also going to get hampered. So when the body is not in a state where it can absorb the amino acid effectively,
the body is going to start consuming itself, right?
Exactly. That is the same thing that was happening. Another thing that we were able to basically understand when we look at his GI map was all the psychological stress that was getting dumped in and messing up with his gut microbiome.
You could see that.
Definitely.
Okay, wow.
So his lactobacillus was quite elevated. His enterobacter was elevated. Along with that, there were multiple opportunistic bacteria that were quite on a higher side. Bacillus, Pseudomonas, Streptococcus, Staphylococcus, quite on a higher side. And these are really important because they make sure that your gut ecosystem stays as it should in a healthier
Right.
state. And another marker that we look to get a significant idea about the mucosal barrier is Akkermansia mucophilia.
Which is what?
So Akkermansia mucophilia is basically a keystone bacteria.
And it was 0? Like what?
It is completely below detectable
Wow.
level. So this Akkermansia is basically a keystone bacteria, which actually makes sure your gut lining stays as it should, that is in a healthy state. So it is basically present, it basically makes sure that the mucosal barrier that is present between the gut lumen and the blood circulation is staying as it should.
Okay, that sounds like a really important role.
Yeah, and when there is none of this bacteria is there, basically there is not just leaky gut, basically there is a free pathway for anything to enter into the blood circulation. And once it enters into the blood circulation, it can get transported to any other part of the body because your gut is connected to different organs in different ways.
Right.
And this can also cross the blood-brain barrier.
Wow, and this is the mechanism, right? Like gut infections, destroyed mucosal lining, systematic inflammation, the immune system fires and fires and fires, and eventually it starts firing at the myelin sheath.
Yeah, and the conventional medicine actually comes at the last, where the immune system has already started attacking the myelin sheath. They directly mention this as an autoimmune condition.
Right.
They'll always try to edit what is happening at the last. They won't understand what is the reason behind it. The first chapter is something that they missed out to actually read or to understand before actually treating the condition properly. And at this point is where we actually start going at a cellular level. That is the OMX test.
Okay, so this OMX, the organic metabolomics test, measures mitochondrial function, neurotransmitter metabolites. This is where, when we saw that, we stopped theorizing and we actually started seeing the cellular reality of what was really happening inside Rajesh's body. What did you find?
So we measured his homovalenic acid. It is basically a primary breakdown of your dopamine, basically. So this parameter actually gives us an idea about how much amount of dopamine your body is actually making and it is getting metabolized. So the range for it is around somewhere 40, 42. So Rajesh was just 19.6. So his body was actually making only half of the dopamine that is made by a normal individual. And here's what none of the neurologist or anyone is going to tell about dopamine. It's not just the feel-good hormone. Dopamine is a neurotransmitter which plays a crucial role in your motor control. So it allows your brain to actually send precise and coordinated signal to your muscles. So when the dopamine has completely collapsed, what Rajesh has been experiencing, the poor coordination, muscle weakness, inability to actually perform the fine motor skills, all of these symptoms show up in this case. And his body has been trying to tell all of these things since quite long years.
2016, right?
2016, right? So through every stumble, through every limping step, his body was not just broken, it was basically trying to communicate what is happening
There's
inside.
not enough dopamine to control.
Control it. But it doesn't stop over here.
Okay,
We also got to know a lot of things when we looked at his tryptophan metabolism.
okay.
So tryptophan is an important thing which gets converted into your serotonin, which is like a calming and feel good wala hormone. So his tryptophan was extremely low.
And what would that mean then for the body?
That is basically the body is not able to make sufficient amount of serotonin. And along with this,
I bet most practitioners don't even know this, Shreya.
Yeah,
Tell us why this is important.
So tryptophan is basically important for conversion of your serotonin. So serotonin gives you that calm and stabilizing, basically it regulates your mood properly. But not just tryptophan, but his KT ratio, where his kynurin to tryptophan ratio was also elevated.
Okay.
So when there is a lot of neuroinflammation, your tryptophan ideally should get converted into serotonin.
Right.
Because of this inflammation, it starts getting converted into the kynurin,
Which is toxic?
which is extremely toxic if it is present in a very high levels. And it has a direct impact on the nerve signaling, the nerve health itself. So his levels were somewhere around 0.116 and the range should be actually below 0.101.
Wow. So 100 times, 1,000 times, like I don't know the math. But
Yeah. But it was quite on a higher side. So This actually opened our eyes, and we got to know that we came to a statement where MS is not just an autoimmune condition, not just simple autoimmune condition. It's basically an inflammatory state which is driven by your mitochondria when they're not functioning as it should function. So your immune system is continuously attacking the myelin sheath, which it should not do it. So it's basically end results of years and years of the gut inflammation, the depletion of the neurotransmitters, the destabilizing environment that is happening in the new nervous system, which is basically the body is continuously in the survival mode.
So the immune response is not really the disease, it's a symptom. And every immunosuppressant that Rajesh, poor thing, was given was suppressing the response to the fire, and without anyone ever asking what lit that fire inside the body, right?
So Rajesh, he was vegetarian since 2 years before we actually come to us. He was well-intended one. Plus, his gut was so messed up that we got to know that his body is not absorbing the protein well.
Even the vegetarian
Yeah,
one.
even the vegetarian one, whatever he was getting through the dals, the sprouts, anything that he was having in his diet. And that also showed in his amino acid profile.
Okay.
So histidine levels were pretty low, which is important during the stress. There is glycine. It's again one of the essential amino acid for collagen synthesis for the central nervous system. Lysine, which is critical for the muscle repair. It is important for the production of the carnitine, and carnitine is important because it transports the long chain fatty acids to the mitochondria.
Wow.
So your mitochondria can use those fatty acids and make good amount of energy.
So his body was literally starving at a cellular level, not for calories, I think, but like for more specific molecular building materials that every cell, every membrane needs to sustain itself. And we found that through a test. What else did you find?
And on top of this, his urtic acid was extremely elevated. So it was somewhere around 20.6, it should be less than 13. So it's a marker of ammonia toxicity. So when the liver detoxification pathways are overwhelmed, this ammonia is definitely going to get accumulated in the blood. And that is again going to have a direct impact on the nerve functioning. So this ammonia toxicity is basically messing up with all of his nervous system and triggering all of these symptoms. So when we looked at his case, we looked at 5 ways simultaneously. First one was the amino acid starvation. That was happening because there was no raw material for your body to actually repair and rebuild. The gut derived inflammation, which was coming from the infections, the mucosal barrier, which was impacted, the ammonia toxicity, which has a direct impact of poisoning on your mitochondrial health. Then the neurotransmitters, specifically the dopamine, serotonin, the feel good hormones, their production was dropping down. And last but not least is the mitochondrial failure, where the cells of his nervous system was running in empty cells.
So conventional medicine basically arrived at that very last point on that list and said, autoimmune disease. Here are your immunosuppressants. We'll see you in 3 months. Just keep going. So Shreya, let's talk about how we actually approach this, right? Like when a case is this layered and this interconnected, you cannot just throw one supplement at the symptom. You need a framework. You need to see the whole story, and like to write the first line of your protocol. So walk us through, and all the academy students, on how you actually worked on solving this case.
So we always begin with the diagnostic triad. So there are 3 different layers that we check in. So it involves is comprehensive blood panel, where you get an idea about basically body's current metabolic state, inflammatory state. We get the GMAP test done, where we get an idea about the infections, the gut immunity, and how well your mucosal barriers are there. And last not but the least is the OMX, where we get to know about the mitochondria, the truth about the mitochondria, and whether the body is actually producing enough amount of neurotransmitters or not. So the blood is basically going to tell us what is happening, what is wrong. The GMAP is going to tell us why it is happening. And the OMX is actually going to give us an idea about what is happening at the cellular level itself. So most of the practitioners actually stop at the first level itself. But over here, we do all of these things together, because one single chapter is never going to give you an idea about the complete story. And then we move ahead with the 3-pillar protocol.
And what was pillar 1?
So pillar 1 was focusing on the gut infection, the gut health.
Okay.
It was basically phase 1, which lasted for 2 months. So over here, because he had H. pylori, so we added H. pylori herbs, we added immune support, we added proper binders. Along with that, we added leaky gut supplements, gut nutrients, which is going to support the gut lining to heal. And the one of the important bacteria which was missing in his case, the Akkermansia. We also added a supplement for that because that is also important. It is going to make sure that the healing is happening properly and it prevents any kind of a pathogen to again re-enter into the blood circulation.
So that was foundational repair of the gut. What was pillar 2 then?
So we focused on restoring the mitochondrial function. So over here we added the master antioxidant, the glutathione. It reduces the oxidative stress at the mitochondrial level itself. Then we added magnesium, one of the again essential supplements which acts as a cofactor in ATP production.
Right.
B vitamins, important role to play in the Krebs cycles. Then we have omega-3, which is going to cater down the inflammation, not only at the gut level, but it is also going to support the mitochondrial membrane and the integrity of it. And then we added the plasminogens.
So this is interesting. Tell us more because this is cutting edge. Most practitioners haven't even heard of plasmalogens.
So plasminogens are basically the specialized class of phospholipids. So they actually help us to make majority of the myelin sheath which basically protects your neurons. And in MS, this myelin sheath itself is under a constant attack. And this myelin sheath basically is important because it makes sure that your body and brain basically they communicate with each other. Signaling is basically happening properly. In conventional medicine, they always mention you cannot repair or restore the myelin sheath. You can prevent the further damage, but you cannot repair or rebuild something that has already been damaged. The plasminogens actually challenge this assumptions basically. So we are basically giving something that the body has been asking since quite long time. That is going to repair the myelin sheath that has been continuously under attack. So we recommend the Promidom's neuroplasminogen oil.
Okay.
It's not a miracle, but basically in biological conversation, we are giving something that the body wanted since the start where it actually happened.
Great. And what was pillar 3 then?
So pillar 3 was all about rebuilding the neurotransmitters. So here we added essential amino acids. So these are basically the molecular precursors which are required for your tryptophan and your serotonin production. Along with that, we also added B6 because B6 is an important precursor. It will make sure your amino acids are properly getting converted into the neurotransmitters. Then comes your berberine, which again one of the master herbs, which is given in case of glucose metabolism. It is also going to help to reduce the inflammation. And critically, one major thing that we changed in his diet was reintroducing non-veg in his routine. Because his body was missing on all the carnitine, the lysine, the complete amino acid, which it required to repair itself naturally. So over here, we basically considered food as a medicine, right? So that is the approach that we applied over here as well.
And all 3 pillars are in sequence, right? Like you cannot rebuild neurotransmitters while the gut is still on fire, or you cannot repair mitochondria when the liver is still overwhelmed by ammonia. And the sequence, I think, really matters as much as the intervention. Like the food as medicine should be step 1 before even all the supplements begin. Now, tell us what happened once you did these things.
So in phase 1, which was basically for the 2 months, we were working on majorly on the gut because as you mentioned, you can't build the building unless the foundation is completely set up, right? So within the first 3 weeks, Rajesh started noticing some changes, not in the leg, but something from inside itself. So his brain fog actually lifted. The sleep issue, which he was having since lot of years, it got improved. His energy levels started slowly stabilizing. So there were a lot of small changes, but when the body has been through a lot of struggle since long years, even these small changes actually feels like very enormous. It's like the big wins that one can experience. In phase 2, where we actually focus on the mitochondrial health, the neurotransmitter restoration, that is where his body actually began to remember how much capable it was. And in phase 3, that is the last 3rd month, he was able to walk properly without even limping.
It's unbelievable, no?
Yes. So his legs actually started regaining the muscle strength. So from barely able to hold the slipper, he was able to walk properly, not just for few minutes, but for hours and hours every day. So he was managing like 30,000 square foot shop alone. He was just mentally, physically, in every manner, he was just present over there. And in his word, I still remember his words. He said that his body has started smiling again.
Body has started smiling. That's so cute. So we didn't really just treat his MS. We didn't fight his immune system. We didn't suppress or sedate or override. We listened to what his body was trying to say for so many years: the gut infections, the mitochondrial dysfunction, the amino acid deficiencies. And when the body was given what it needed, it healed itself. So, if someone is a current academy student or if they're a practitioner waiting to enroll in the academy, Shreya, what is the one thing you want them to carry from Rajesh's case?
So there are actually not just one, but there are three things that are there. These are not clinical principles, but they are a way of seeing it. First one is complexity, is not incurability. So what happened in Rajesh's body was very enormous because there were multiple systems involved, there are multiple root causes, all of them were compounding each other. But complexity is not as same as impossibility. So when you have proper training to see the whole picture and when you have adequate tools to address it systematically, the body's capacity to recover with consistently exceeds your expectations. Second, the test that you don't run is the answer you'll never able to find.
Nice.
OMX is the piece which in conventional medicine they were missing on, because it gives us an idea about the dopamine collapse, it gives us an idea about the neuroinflammation, the amino acid starvation, and without all of these things it would be like just trying to cure the body in the dark. And when you're working on any condition, the diagnostic triad comes over here. So diagnostic triad exists because the body's story is never told in one single chapter.
Correct.
You have to go back and you have to go more in depth if you're not able to tackle down anything. Third, but not the least, is the sequence matters as much as the selection. You cannot rebuild a house while it is still on fire, as you said. So the three pillar protocol works because it has sequenced. So gut was first, then the mitochondrial health, and then we focused on rebuilding or replenishing his neurotransmitters. That actually separates functional medicines from someone who transforms, from the functional medicine who is merely the thinkers.
In fact, in the iThrive, the course, right, the iCFN course, we break down cases exactly like this one. We teach you how to read not just basic blood work, but advanced tests like the OMX, to build a diagnostic triad for your clients, to build sequence protocols where food is medicine, and of course, you're addressing gut, mitochondria, neurotransmitter pathways, so many things simultaneously, right, with supplementation. And this is not information that you will ever find in a standard nutrition certification. We both know, we've done our masters in nutrition. This is the clinical depth that most complex cases demand and that the people who are suffering deserve. If you are a current academy student, your next case with neurological symptoms, MS, Parkinson's, migraines, brain fog, unexplained fatigue, run the diagnostic triad. Let that body tell you its whole story, okay? See what you find, bring it into your next coaching call. And if you are watching this and if something in you has just shifted, if you recognize something of your own story or your patient's story, in Rajesh's case, know that this is not an accident. The body is sending you signals right now that it's not broken, it is communicating. By the way, our next iCFN cohort is open now. The link is below. Come and learn to listen from us. Shreya, final thoughts?
In case of Rajesh, his dopamine was pretty low. It was just 19.6. It should be normal. Normal range should be 42. And nobody told him. So nobody connected that number to the foot that was not able to hold the slipper, the muscles that were not able to coordinate properly, and to the man who was quietly losing himself over the years and years. And this is what we changed at iThrive. Not just the outcome for the individual patient, but the quality of attention that we provide to the patients. That brings people front of them. Because every person is suffering, it deserves a clinician who actually asks the why, who looks at the body as a whole picture, who trusts the body's intelligence rather than just overriding it. And this is what we actually teach over here. It is why this work actually matters a lot.
And for all of you watching, thank you so much, because this is the work that everyone deserves. And we'll see you in the next health audit soon.